Welcome to the American Lung Association webcast, Respiratory Health and Climate Change, What You Need to Tell the Public. I am your operator today. My name is Erica. Before we begin, as a reminder, at the bottom of your screen there are multiple application widgets you can use. All of the boxes are resizable and movable, so feel free to move them around to get the most out of your desktop space. For the best viewing experience, we recommend you using a wired internet connection and closing any programs or browser sessions running in the background that can cause issues. For the best audio quality, please make sure your speakers or headset are turned on and the volume is up so you can hear the presenters. And make sure the media player on your screen is enabled. If you have any technical difficulties during the webcast, please let us know via the Q&A box. During the webcast, you will have an opportunity to ask questions. You can submit a question to the panelists through the Q&A box. This webcast is being recorded. A recording will be available tomorrow and you can access using the same link you used to register. And now it is my pleasure to introduce Janice Nolan, National Assistant Vice President of Policy to the American Lung Association.
Thank you so much, and we're delighted to have you all here today. Thank you for taking time from your busy schedule to help us make sure that you know more information about the impacts of climate change on respiratory health. And also, we can help you prepare with materials that we prepared to help you help your communities learn more about the impacts of climate and how they can protect themselves. So we really appreciate the opportunity to have this conversation with you. This next slide shows the organizations that are involved in today's activity. We, or the American Lung Association, are the grateful recipients of a grant from the CDC to fund this. They have not endorsed this material, so please don't assume that they are signing off on it, but we've kept them in the loop about what's going on. We're also working with our partner organizations, of which many of you are members, the American Public Health Association, the Association of Schools and Programs of Public Health, the National Association of County and City Health Officials, and the National Environmental Health Association. They have helped us target this material, hopefully so that it will be ever more useful for you as you go forward. My name is Janice Nolan. As was mentioned, I am the National Assistant Vice President for Policy for the American Lung Association. I've been working on indoor and outdoor air pollution and am the producer of our annual State of the Air report. And I'd like to introduce somebody I have long admired, and that is John Balmes. He is a physician and professor of School of Medicine at UC San Francisco, and also at the professor of environmental health at UC Berkeley. And he's also one of the great roles that I think brings a lot of expertise to us with his experience is his role as the physician member for the California Air Resources Board, which is the regulatory agency in California dealing with the health effects of air pollution. So I'm looking forward to, I'll turn it over to him when we get to that point, but I just want to introduce you, share a little bit more about this with you so that you can be aware of what we're planning to do today. Again, the purpose of today's conversation is really to help inform you about the threats of climate change on people with lung diseases, with respiratory diseases, and they're very diverse, many of which you've probably already thought of, but there are always new ones that come to our information as we go through some of these experiences, and we want to share that information with you. We also prepared materials and resources that we hope will be helpful to you in working with your community so that you have something ready to go in the can that you can share with people that can give them information about protecting themselves from these threats. But to make sure that we're doing this in a way that's helpful for you, we are going to ask you following this to fill out a questionnaire. We have a very short questionnaire that will be coming to you, asking you about your responses to today's presentation, to the information that you've learned, to see if it was useful, if there's other information that would be helpful. So your response to that would be very, very welcome. In addition, in a few weeks, we will send you a second questionnaire, again, a quick one, I promise, that asks how you've used the resources, if they've been helpful to you. Our goal is not just to give you something that you're going to sit on a shelf, but something that's actually helpful to you as you do your work. And we want to make sure that what we prepare for you is as helpful as it can be. As you know from the daily news, as we've clipped on some headlines here, climate change is in the news every single day. The flooding, the wildfires, change in weather patterns have created an abnormal world for us in much of the country. These are just a few examples of the kind of things that we're seeing. We also know that we have millions of people in the United States who face great risk because of their lung diseases. We have 35.7 million Americans who have lung diseases, and that includes more than 25 million with asthma, of which more than 6 million are children, and more than 13 million adults who have chronic obstructive pulmonary disease. So there's a lot of people in your communities across the nation that face special risks because of their lung disease. So let me turn this over to John Balms, and Dr. Balms will help you understand a little bit more about the impacts of climate on health. John?
Thank you, Janice. It's my pleasure to talk to you about the impacts of climate change on health, especially respiratory health. So, the impacts of climate change are already being felt across the country. I'm not going to spend a lot of time trying to convince you that climate change is happening. I think I'm not going to insult the intelligence of this audience in that regard. But many of you may not be quite aware of how important climate change is in terms of global public health. And a high-level commission sponsored by The Lancet said that tackling climate change could be the greatest global health opportunity of the 21st century. And this slide shows many of the climate change effects on respiratory health. So there's the direct heat effect that's down the bottom right at about 5 o'clock, heat waves. So people with pre-existing heart and lung disease are particularly vulnerable to acute heat stress leading to heat-related illness and even death, directly related to climate change and global warming. You probably also know that air pollution, especially ozone, is related to respiratory health, and ozone will go up directly with increased heat due to climate change and global warming. To adapt to that increased heat, we have to run air conditioning to deal with the high temperatures on extreme heat days, heat waves, and that requires energy, which, unless it's generated from renewable sources, increases particulate pollution, also oxides of nitrogen, which also have health effects. I'm from California, and wildfires are another direct consequence of global warming. And wildfires, of course, have direct health effects, both in terms of fires overrunning communities like Paradise, California last November, and increased particulate pollution due to the wildfire smoke. Another concern about respiratory health that many people may not be aware of is increased exposure to allergies, which can exacerbate asthma as well as allergic rhinitis because of a longer growing season and increased pollen production. We're going to talk about all of these health effects of climate change on the respiratory system in the next few slides. So with people with lung disease, which the Lung Association is particularly concerned about, have potential health effects from air pollution, from extreme weather events, which lead to flooding, increased allergen exposure, disruption to communities, and in particular, as the last slide also mentioned, the most vulnerable members of our population are the ones that are probably going to be most impacted, the ones that are least able to adapt to the changing climate. This is true in the U.S., but it's also true globally. For example, Bangladesh a very poor country with many health burdens to start with, is predicted to be 2/3 underwater by the end of the century. Where are those people going to go, for example? But in our own country, it's also the disadvantaged communities that are most impacted. So specifically, worsening air quality. So higher temperatures, more hot sunny days means increased ozone. And it also means increased dry weather and even drought, like we've seen in California over a number of years, which increases the risk of severe wildfires. For example, in the Sierra Nevada mountains, over 160 million trees have died due to the drought. There's also more dust storms in the Mountain West with these dry conditions. And increased particle pollution directly related to the dust storms is also a health problem. You know, we focus on fine particulate from fossil fuel combustion, traffic, and coal burning for power, but just soil-related dust has health effects, especially with people with asthma. So I've mentioned ozone. It's a big problem in the western part of the country, but also in the east and southeast with increasing hot, sunny days. Ozone is a powerful respiratory irritant. Directly can cause airway inflammation and decrease lung function, and people with asthma are particularly at risk. And there is also evidence that ozone exposure can have effects on premature mortality. The evidence isn't as strong as fine particulate, but it's enough that it's concerning. You know, I've already mentioned the increased drought. This is a risk factor for windblown dust storms, and those dust storms can cause exacerbations of asthma and chronic obstructive pulmonary disease. Wildfires has been a huge problem. I think it's interesting that the Lung Association slide here shows wildfires in the northeast of the U.S. and the plume going all the way down to the mid-Atlantic. If you look at the map to the left on the slide, you can see most of the fires are in the mountain northwest and in California. So I just think it's interesting that occasionally there are big fires in the northeast, but we've suffered greatly in California and Oregon and Washington, Idaho, Montana, from catastrophic wildfires, which used to occur only occasionally, but they're increasing in both the number and duration. And these are due to climate change, but they're also climate forcing. The black carbon that's released directly is climate forcing, increasing the problem we have with retention of heat in our atmosphere, but it also generates secondary pollutants like ozone and oxides of nitrogen, which are also climate forcing. So not only are the wildfires caused by climate change, but they make climate change worse. And it's been estimated that a single large wildfire in California, like the Camp Fire that took out the town of Paradise in Northern California, that's worth many, many thousands of motor vehicle emissions in terms of its climate forcing effects. So I probably don't need to tell this audience that the fine particles that are in wildfire smoke directly impact the respiratory health of people with asthma or chronic obstructive pulmonary disease, but they also increase the risk of acute cardiovascular events as well. And, the wildfires disrupt families, neighborhoods, especially when neighborhoods are evacuated. Healthcare services are strained. People have to be evacuated into shelters where there's problems with, crowding, post-traumatic stress, infections. These are major disasters, akin to earthquakes or hurricanes. I already mentioned this to some extent, but to go into a little more detail, the map on the right shows ragweed. And, people used to move from the Midwest and East to California to get away from ragweed allergen. But it's interesting that the ragweed plant photo here is right over California, because we now have a fair amount of ragweed in California with climate change. And interesting facts about ragweed, which is a potent allergen, is that pollen from the ragweed plant increases with higher levels of CO2 in the atmosphere, and the growing season is also longer. So we expect, and this is true for other allergens aside from ragweed, flowering trees in California. They start flowering about 2 weeks earlier than they did a decade ago, and continue to flower for a longer period of time. So there'll be increased exposure to allergen among sensitized persons, which we expect to cause both increased allergic rhinitis and increased asthma attacks. Along with the extreme weather, along with climate change, there are extreme weather events. They've been happening globally. So severe storms, sort of starting with Katrina, including Hurricane Sandy, the recent hurricane that devastated or caused major flooding in Houston. I think there was Harvey, the one in Puerto Rico, Maria, I believe. I may be misstating the names of the hurricanes, but these. They've devastated large areas on multiple levels. And, for example, in Puerto Rico, I think over 2,000 people have died related to the hurricane. With these extreme weather events, there are incredibly powerful impacts to individuals and families. There's increased pollutant exposure, and definitely increased stress, economic strain, issues about where people can live, access to medical items, whether those are for diabetes control or asthma control or heart failure. And evacuation is a very disruptive event. And shelter environments, they're great that they exist, but they often are vectors for disease and other problems. So this is I think a photo of Bellevue Hospital after Hurricane Sandy, the major public health hospital for Manhattan. And, the hospital had to be evacuated in terrible conditions. And this is just an example of the impacts on the healthcare system to these extreme events, whether they're wildfires, hurricanes, or floods. And the photo on the left on this slide is showing mold, which is a major problem after floods. And individuals with mold allergy, especially if they have asthma, can have severe responses to this kind of exposure. It's not just mold. In Katrina, for example, as the floodwaters receded, the remaining mud, which turned into dust, contained highly toxic materials from the industrial facilities and port facilities that got flooded. Just imagine, hundreds, thousands of cars, ships, industrial facilities with chemical storage, and that contaminated the water. As the floodwater recedes, those toxic materials get deposited on the mud, which then becomes dust, which then becomes airborne, which involves, causes inhalational exposures. And in terms of the infrastructure, one of the particularly sad consequences of the impact on the infrastructure was the Harris County Jail in Katrina actually got flooded. Inmates were actually having to tread water to keep from drowning until they could be rescued, and it took a long time for them to be rescued. So recovery from these extreme wildfires and weather events have long-term impacts. There's no question they have long-term impacts on mental health, on personal property. The cleanup and repair process can also be hazardous. After a wildfire, for example, there's toxic materials in the ash after the fire is put out, and if people come back to their homes, even if they didn't lose their home is covered with ash, both inside and outside, which has toxic materials, and if they're not properly protected or the house isn't cleaned up properly, there's exposure to toxic materials in the inhaled dust. And as I mentioned, it's people of color and those living in low-income communities, the most disadvantaged members of our population that are at greatest risk from these disasters, whether they're wildfires or hurricanes. I mean, in Sonoma-Napa fires in October of 2017, the farm workers who picked the grapes in that very, the rich wine country are often low-wage immigrant workers. They lost their housing. Where were they going to go? People with more means could afford to go into a hotel, but not necessarily these low-wage immigrant workers. Same thing happened after Katrina. And who also does the cleanup? A lot of times the cleanup after the hurricane or wildfires are, again, low-wage immigrant workers who are not properly trained or protected. So both domestically and internationally, it's people that didn't really create the problem that have the greatest impacts and the least resources to adapt to the changing climate and consequent disasters. So I think I'll stop there and ask if there are any questions. I hope I've been able to at least give you an overview of potential health impacts of climate change and natural disasters that occur as a result of climate change.
Thank you so much, John. And if people do have questions, there's a Q&A box on the screen that you can type questions in. I don't see any right now, but wondering if folks have any questions.
Well, there are no questions at this time.
Thank you. Thank you so much, John. And I hope you can hang on a little bit longer for our conversation. Right now, I'm going to take us back to talking about the materials and the resources that we put together to help you share some of this information with other people in your community and provide them with some information that that hopefully will be helpful to them in their preparation for these kind of events. Communicating these messages can often be a bit of a challenge, but it's crucial that we do that as best we can. We want to make sure that people understand that this means something to them and their condition and their disease and their family, but these can be hard. We want to make sure that people are aware that these impacts can change your health, can change your life. And so incorporating these kinds of messages in the regular communication that you do and identifying actions that people can take to prepare and to be aware of what they may need to do in the event of an emergency or as things change are pieces of information that we think will be very helpful for the communities that you serve. We want to make sure that they see these events, like John mentioned, like the changes in air pollution, changes in pollen, the effect of storms and heat, as things that they need to pay attention to, and also as things that they can help prepare for and deal with these events, because they are coming, and that's an important message to share. There's also a challenge, because sharing information about climate can be sometimes a little hard for some people to receive or to perceive, also because their priorities are diverse. They've got a lot of issues they're dealing with. They, as John mentioned, they're dealing with putting food on the table, and it's not always a top priority for them to make sure that they've got some equipment that they may need or a plan that they may need. But respecting their views and their concerns, but also helping them to understand that there are an array of issues that they're going to likely be faced with, and that the best thing would be if they could begin to prepare are important messages for us to share with the public. So we have developed two tools, basically two large or one-page full fact sheets that we're going to share with you. These fact sheets will be downloadable. They are written at an 8th grade level, reading level, and they're really designed to focus on information issues that speak directly to the people in your communities who have lung disease. We're still working on the final details of these, but I do want to go through with you on what they will show. The first is a fact sheet that tells basically what you need to know. It's information about how climate change exists now, and how it does now and will in the future affect their ability to breathe and to work and to have good health. It talks about various contributors to that, like the pollution that we talked about from the air quality changes, the increased risk of allergens, and the increased problems and risks of things like severe storms and flooding. We also have information on the fact sheet, the first fact sheet, about this disruption, so that it sort of can convey some clear understanding for them about some of the risks that are in the communities that they're looking at, so that they can understand how it might affect them and their family directly, between the evacuation and traveling, all the way to having the impact on, as John mentioned, the hospitals that are serving them, or the physicians that are talking to them, and the medical information about them that they have available at their disposal now, having that possibly removed from their ability to reach it going forward. So we want to make sure that they understand how this can be disruptive, and that they recognize, as we do, the impact on communities that are already heavily burdened by these challenges, and why that can be even more of a challenge for them, and why that's important that they be prepared, or at least aware of this as they go forward. Then we have a second fact sheet that is a tip sheet that really gives some positive tools and ideas and advice on how to protect yourself. It really gives us some specific advice, information about preparing for and understanding the issues of evacuation and returning home, but also just the basics of dealing with the impacts of climate change. For example, in the basics, we have information that you would probably already have in your materials for people with asthma. For example, have a management plan, keep your medicines ready to go. But also things that they may not be thinking about, like paying attention to the air quality that's there, or looking ahead for making sure that they've got water available at home in case something like this happens to their community, to their home. We also want to provide them specific information about evacuation, so that they've got knowledge that not only do they need to do the things that we will tell them all the time, follow what the local authorities say, but making sure that they know that they need to have some of these materials to take with them if they have to leave, like paperwork, treatment plan, cards, your insurance card. Figuring out things that may not even be on their agenda, like how are you going to get electricity, for example, if you have portable oxygen machine and you need to take that with you. How do you work on there? There's some tips and links to places that you can find out more information about that as they go forward. But the key thing is to help them identify that these are things they need to look at, and here are some resources that it links to that helps them find additional information about how to prepare, along with some little bits of information that can be helpful directly. They don't have to look that up, but some things to be thinking about and knowing that that is available. We also want to make them aware, as John mentioned, of the challenges of returning home, because once they have to evacuate for whatever reason, returning home poses a lot of problems that they may think of, like seeing the mold and how do we get rid of the mold, but things that they may not be thinking of, like some of the challenges in cleaning up and the health risks of removing these things from your home, or removing the material, or dealing with the debris that you're going to have to address. And also making sure that they can provide safe opportunities for having electricity while the electricity is out. So we go into some specifics on this page as well that's still very small. We're not getting into a lot of detail, but it gives an idea that these are things they need to look at, and there's links of information about where to go for much more information on each of these. We also want to make sure they're shareable for you. So as I said, we're working on the final details of the fact sheets. We've gotten them in very good shape. We're going to be posting them on our website at the address you see there, lung.org/climate-change, early next week as we get them finalized. And we'll be sharing them with your organization so that they can be posted on their website, so they can be downloaded easily, or you can post them on your local website, for example. And they can be printed and distributed so that there are things that are readily available for you to use in your community. We've also added Spanish language versions of these. We've gotten them translated, and we're developing those final presentations, those final papers that have the Spanish language translation of this, so that you can use it in a more diverse community than just English-speaking people. So let me stop there and see if there are any questions about what I have shared, or any questions about anything so far.
Absolutely. We do have a few questions that have come in. This question came in just after John's presentation. It says, I'm working internationally. Are there data for those 4 countries that were referenced during that presentation?
Well, so Bangladesh was one country I mentioned. I don't remember the other countries that I mentioned, but Bangladesh is a low-lying country with major river going through it, and so with sea level rise, 2/3 of Bangladesh is projected to be underwater by the end of the century. It's not just Bangladesh, however. Florida, much of Florida, not 2/3, but more like a third, quarter to a third, will be underwater by the end of the century with sea level rise. So we didn't talk about sea level rise directly, but that's a consequence of climate change, and it actually is part of the reason there's increased flooding risk of cities like New York and New Orleans with storms. Great. But there are data available about all the countries in the world that will be impacted by sea level rise. Some of the island nations in the Pacific and Indian Ocean will be totally underwater.
Great. Thank you so much. Our next questions refer to increased vector-borne diseases and valley fever from climate change.
Yeah, I'll take that. So I didn't talk about vector-borne infection, mostly because I can't talk about everything. But mosquito-borne infections will be increased throughout the world in areas that currently don't have those, and that includes the U.S. So we already have more West Nile virus in areas that previously didn't have the West Nile virus, like California, Northern California, which is in part due to climate change. But malaria may return to the southern U.S., and dengue fever is another possible vector-borne infection that may return. But without question, in places that already have malaria, like parts of East Africa, it's now in lowlands, but as climate changes, it'll move to higher elevations where currently malaria isn't present. So vector-borne infection is a major consequence of global warming.
Great, thank you so much. We'll take our next question. Any new information on the inhalation of microplastics from burning?
Well, microplastics are an important environmental hazard. We don't know very much about the levels of exposure and certainly long-term impacts of inhaling microplastics, but increasingly there's evidence that all of us are probably ingesting and possibly inhaling microplastics. It's a big concern. If I had to get rid of all the plastic in the world, I'd want to do that because unfortunately, as convenient as plastics are, they're also they hang around for a long time and they damage the environment in multiple ways, especially the food chain. So we just need more information about microplastics, but I suspect it's going to be a much bigger problem than we currently realize.
Wonderful. Our next question, what do you feel is the greatest influence on underserved communities influenced by climate change?
Well, I'll start. Janet maybe want to chime in as well. Just going to California, where I'm from, low-wage immigrant farm workers are exposed to the hottest temperatures in the Central Valley while picking crops. And we already know, even prior to current climate change, that those workers were prone to heat stress, heat exhaustion, and even death. And we know how to prevent that with breaks, shade, water, but it's been hard to enforce there's actually regulations for, and it's only going to get worse. Right now in the Central Valley, there may be less than 10 days a year where there are extreme heat days. This is on average, over 104. But by mid-century, it's going to be like 50 days. And 2 months out of the year of that kind of extreme heat above 104 degrees is going to mean that agricultural workers and construction workers in California Central Valley will essentially not be able to work without air-conditioned spacesuits. So that's a direct economic impact on the most vulnerable workers. And where do these folks live? In housing that's less than optimal, and they may or may not have air conditioning. And you really need air conditioning to survive when you have heat waves where there are multiple days over 104, 105 degrees. So that's just an example in one area of one state where there's that kind of impact. But this is really an impact all over the world. Again, people in countries that have the greatest threat in terms of increased heat and sea level rise, tropical storms are the people that least contributed to the global warming that we see, which is mostly due to the industrial north. So the people that are least able to adapt to climate change, have the least resilience, are the ones that are most impacted by our continued need for burning fossil fuels.
The only thing I would add is that we are seeing this going across the nation in many places. As the slide showed, when you talk about wildfires, for example, the smoke goes a long way. And some of that contributes to problems around the country in areas that can't deal with it because they don't have any resources to do that. You also have areas, thinking particularly of where the relocation is happening, where there's a tribal area in Louisiana where the tribe is having to move from its historic island because of the flooding and the change in the water levels that are coming up, and so they're having to move in their community. But I think the biggest one for me was looking at information from Sandy, where I heard stories not only of the impact directly on the hospital, but on the servers who were trying to help the patients, who were having to figure out how they were going to get the patients out of the hospital. Especially a lot of, in the public hospitals, didn't have a lot of resources, but the elevators didn't work because they didn't have power, and they were having to move folks just around in an emergency situation like that. But definitely, outdoor employees tend to be people who have a lower income because it's warm out there and they're having to drive, or they're having to clean, or they're having to do construction or agricultural work. So they're definitely around the country going to be directly affected by the impacts of these, as well as having to deal with the secondary effects of having to move or not having the health care that they need, all of which can have a huge impact.
Thank you so much. We'll take our next question. Will these materials be available in other languages beyond Spanish?
Right now, we only have the funding to do Spanish, but I know there are a lot of languages out there that you all are dealing with. So let's talk about this and see if there's a possible way to work with folks that you may know of who can do translation into other languages that would be useful for you. We knew we would need Spanish. We also know there's tons of other languages, so let's work together and see if we can figure out that. If you've got a special demand of an area that you think would be really helpful in a language, let us know.
Great, thank you. Our next question. Can you remind us about the names and affiliations of the two presenters? Also, will today's slides be available? Thanks again.
Yes, today's slides will be available. We will have this presentation recorded so that you can see this at your will after it closes today. And my name is Janice Nolan. I'm with the American Lung Association here in Washington, D.C. Dr. Balmes?
Yes, and I'm John Balmes, B-A-L-M-E-S. I'm a professor of medicine at the University of California, San Francisco, and a professor of environmental sciences at the University of California, Berkeley. And as Janice mentioned, I'm the physician member of the California Air Resources Board.
Great, thank you so much. Our next comment. Some groups deny climate change, so I tried talking about air pollution. Many of the same lung issues could be discussed.
Yes, I mean, I think it's very obvious to people. I just think it's very obvious to people that we're having a lot of problems with air pollution, that we're having a lot of problems with wildfire smoke, with flooding, with all these other things. So you can start with them there without necessarily having to argue with them over whether climate change is real or not. I'll stop and let Dr. Balmes talk.
Well, I was just going to say that in California, I don't think people need a whole lot of convincing that climate change is real. Between our drought and the catastrophic wildfires, there's a large percentage of the population that believes that climate change is not only real, but that it's due to man-made emissions, and that we need to be working on it like as hard as we can. And fortunately, the California Air Resources Board, which I'm on, which has a responsibility for climate change mitigation policy as well as air quality regulation, we're trying to get co-benefits from all our regulatory activities with regard to both climate change and air quality. So, for example, by controlling diesel emissions, which we do in California, you don't see very many dirty diesel trucks in California anymore. We both improve air quality, but we also reduce the amount of greenhouse gas emissions and black carbon climate-forcing emissions from those trucks. So we get co-benefits both on climate change and health from our regulatory activities. And people always say, well, California, you have all these strict environmental regulations. Isn't that killing the economy? Our economy is doing great in California, including the green sector. We make zero-emission vehicles battery electric vehicles, and it's not just Teslas, but also battery electric buses, and we are on track to have 33% renewable energy production by next year. So, you can have a green economy that's less reliant on fossil fuels and have co-benefits in terms of climate change mitigation and improved air quality. You don't have to sacrifice the health and the environment for the economy.
Thank you so much. Our next question, will you please comment on measures those at risk can take at home to protect themselves? Air conditioning, air purifiers, HEPA filters in cars and homes, and the use of effective face masks. And there's also an additional question that came in asking if air purifiers are helpful that go along well with this comment.
It's very interesting. You may have heard some background noise. I'm at the Dulles Airport, where I was just at a 2-day conference workshop from the National Institutes of Health and EPA to try to address dealing with air quality issues and how to and personal and home interventions to reduce exposure, particularly to particulate matter. And so, yes, N95 masks will work if you have to be outside during poor air quality, but it's better to be inside with a portable HEPA filter device. Those are affordable for most Americans. You can get a decent one for $200, but again, the most disadvantaged folks may not have the available funds to buy such a device. But those devices are very effective at reducing particulate matter in a room. They won't deal with a whole house. The whole house can be protected if there's forced air ventilation. You can put it on the recirculation mode, and you can have an improved filter. They're called MRV filters, and if you have an MRV filter greater than 13, the higher number, the better the filtration. You can protect your whole house with the windows closed and on recirculation. So we're recommending for wildfire poor air quality, like we have in the Mountain West, to stay inside, close the windows, turn your forced air ventilation to recirculate, and hopefully you'll have a decent filter. And to further protect yourself, you can buy a home HEPA filter device that'll, at least one, that you can put in the bedroom where you spend the most time. You could also get a second one and put it in the area where you spend the second most time. And use N95s if you have to go outside. So there are ways to protect oneself from air pollution.
One thing I would add to that is that we try to make sure people understand that those only protect you from particles. They don't protect you from the ozone problem. They don't protect you from other gases that may be in the area. And to recognize that they are an assistance but not a solution. And so we want to make sure people are aware that, for example, on a high ozone day, you need to check the air quality index and stay indoors, because you're not going to have a device that you're going to be able to use to reduce that exposure. But it is a tool. Those are tools to help you with that. And there are other things that you can do indoors, some of which are expressed in our material for you. Things like, making sure that you are not using the generator that you need to provide portable electricity indoors, that it's not a diesel generator, for example, that you would use indoors, that it's outside and a distance from the home. So there's a lot of specific tips for people in the materials that we prepared for better ways to reduce your exposure in situations like this.
Great, thank you. Our next question, would you recommend that people with respiratory issues or concerns about the air quality where they live or work get their own air quality monitors?
Well, I'd say one of the questions that we have is how effectively those monitors work. EPA has been doing a lot of work looking at those and trying to figure out, and some of them are better and some of them are not as good, and they only limit to certain areas. But everybody has access to information from airnow.gov about air quality that's being officially monitored in their community. It doesn't go necessarily at the neighborhood level, but it can give you a big picture of what the risks are at monitors that we can rely on and say are definitely affected. We also know that there are some areas that are near sources, like near roads, busy roads, or near polluting sources, where those are not going to capture that information always because we just don't have enough good monitors and you're breathing that air. But we do know that knowing those areas exist may be easier to help us avoid having to spend a lot of exercising activity in those areas, for example, or other things. But definitely there's more monitoring available. It's better, but I'm not sure we have Dr. Bottoms may have an idea based on his research on it of what are the optimal choices for individual monitors. And those are expensive devices for people to purchase.
Well, the problem with some of the monitors that individuals can buy, they are relatively low cost compared to the federal reference monitors that EPA uses, but they're still hundreds of dollars, is that they're good for monitoring trends, but they're not as accurate as the information that's in AirNow that comes from federal reference monitors that are used for EPA compliance purposes. So you can use them to assess how bad the air is in your neighborhood, your house, to some extent, but really the AQI data on AirNow is more reliable, and at least in the Bay Area, San Francisco Bay Area, where I'm from, the Bay Area Air Quality Management District puts out public service announcements about the level of air quality that I ask people to listen to, and then also visit AirNow. The problem with AirNow during the November wildfires is it actually crashed a few times because so many people were accessing it. But the Bay Area Air Quality Management District, the local agency responsible for air quality in the Bay Area, did a very good job of getting public service announcements out. So I think that probably varies across the country, but as Janice said, AirNow, the EPA official website, is actually very good.
Great, thank you so much. We have another comment that says, thank you for this presentation. If you find it interesting, we from ABRAS, Pulmonary Hypertension and Related Diseases Association in Brazil, can provide a Portuguese translation for the fact and tip sheet. We would appreciate if we could also share it with our PH, asthma, HF, PF, and COPD patients.
Thanks. I'd be happy to talk with you about that. I think I've got your name and happy to have that wonderful suggestion. Thank you.
Wonderful. Our next question. Are subsidies or grants available to help those in need to install AC and filters in their homes and vehicles?
That's a good question. And, there are some locations where there might be those grants available to especially lower income individuals. I'm not aware of any large-scale programs with regard to the HEPA filter devices. I do know that there were donations to families after the Sonoma-Napa fire. And I know in Missoula, Montana, they also were able to get communities that were exposed to wildfire smoke for many days access to those kinds of devices, the portable HEPA filter devices. But it's actually something that there should be more community grants available, but I'm just not sure that sort of those grants have caught up with the need yet. It's a very good question.
Thank you so much. And we do have a commenter that has referenced that in Florida that they would need information in Haitian Creole.
Thanks. It's interesting to hear the diverse languages that we have to deal with in the United States. I hadn't thought about Haitian Creole, but it's very helpful. Thank you.
Wonderful. And our next question, do you feel like most of the resistance to climate change comes from those who are least affected?
This is Janice. Our perspective is no, it's those who have to clean up the most. The concerns that, at least in terms of the political side of it, from major sources of pollution, that don't want to have to clean up, that don't want to have to deal and recognize that they're having to do that. Now, we are seeing some change in some of that, but it's been slow. And they are definitely folks who are either concerned that they're going to have to install new equipment or close down a facility, or that their jobs might be at risk because of that. We just saw, for example, this week, today, where there were some folks pushing to have to not try to clean up coal-fired power plants because it might affect, even though the climate impacts were real from those, that it might affect the jobs, and they were concerned about that.
Thank you. Our next question. What is the best source for air quality for developing countries in Asia? Does AirNow cover those countries?
No, AirNow doesn't cover anything outside of the U.S. There are Purple Air monitors all around the world, and you can access those from the Purple Air website because it's up in the cloud. But if you went to Africa, you'd find that there are very few. There's a couple in, South Africa, and that's about all. So much of the world is not adequately monitored in terms of air quality. Most of the monitoring is in the developed world and not the developing world. So that's actually an important issue.
Thank you.
And I'll say one thing that's being examined is the use of satellite data to help provide additional monitoring of air quality, because that is not limited by geography. And I know there's a lot of research going on with NASA looking at how they can help with the data that they have in satellite data to provide more information for public health.
Yeah, the problem with that, you're absolutely right, and much research is now being done with satellite air quality data, but getting those satellite data into the hands of government officials in low and middle income countries is another story, because
exactly right.
The processing of those data is high tech.
Thank you. Our next question. What are the most important ways that health professionals can help advance strong policies to reduce air pollution and the impacts of climate change?
Well, I'm going to have to go after I answer this question, and I'll turn it over to Janice because I have to catch a plane. But in my experience, physicians and other healthcare providers, nurses, respiratory therapists, for example, can have impact on policy at the local level, state level, or even at the national level by telling stories about how their patients are impacted by poor air quality and climate change. I think the stories from healthcare providers about our patients are very powerful. Going to your local city council meeting and talking in support of efforts to reduce emissions from governmental sources or other sources in the community, pushing solar power, pushing clean vehicles, that's very important. And I think there's a growing groundswell, not just in California, but all over the country, for cleaner transportation and energy solutions. And I think physicians can play an important role in advocating for these on behalf of our patients.
Thank you, John. We appreciate your time. I know you do have to catch a plane, so thank you so much for your help on this, and we'll be glad to venture on without you. Thank you.
Okay. Bye-bye, all.
Bye.
And we do have one final question. Mold was mentioned earlier. What steps can be used to get rid of the mold? And if an individual with asthma is being exposed, what precautions should be taken?
Oh, this is Janice, and I'll say that one of the things that we're looking at is figuring out the extent of the problem. how big an area has mold in it, recognizing that in some of these places where we're talking about flooding, it's much, much larger than maybe is even visible. It's been water damage. Just know that mold is more likely to be there as a result. EPA recommends that you get professional help to clean any mold growth that covers more than 10 square feet. And again, a professional help might be a good way to identify where mold might be less visible, but also part of the backing or the inside area so that you can do that. We have other information on our website that's linked on this material that we'll share with you about removing and cleaning discarded materials so that you've got materials that can be some materials that's a hard surface can be washed off, others need to be disposed of, discarded, and those are materials that are there. In addition, while you're cleaning up, things like wearing an N95 mask can be helpful, disposable gloves, goggles. Just make sure that you are protecting people who are cleaning up during this process from the stuff that they're breathing. Again, there's a lot more information on our website and also on EPA's mold cleanup website that gives details. We've tried to synthesize it and link to this in the material that we have.
Great, thank you so much. We have several people thanking you for the presentation today, but there are no more questions at this time.
Thank you. Well, let me just finish with the last two slides here. One is the question about what can organizations do, and we have, as the Lung Association and many of the partners who are on this call with us, have signed on to a declaration of climate change and health, trying to make sure that the public is aware of this and that the political officials are aware of this. We have a coalition of more than 20 national health and medical groups that have signed this declaration, and we have a declaration that individuals, 1,300 health professionals have signed on to as well. We're providing these information and use these statements to help deliver the messages to EPA administrators and to others about the impact of climate on health and the importance of taking care of it. Because as this last shows why we do this, we are concerned about millions of people in the United States and around the world who are affected by climate change. And we want to make sure that you have the tools that we can best help you with to prepare them to recognize the health effects and also deal with them. So with that, I'll close, and we will be reaching out with your member organizations that are engaged with you to be here to provide more information. Do know that we will be sending you a questionnaire later on this evening to have, it's a short questionnaire so you don't have a lot to answer, but we would like to have your feedback on this initial call. And also, we'll send another one out in a few weeks to let you know about, to let us know how you're using the materials that we've prepared for you. So with that, I thank you.